All right, so week 6. So a couple of things this week. I will be turning on the homework grades this afternoon, so you'll be able to see what your KGA is with your homework added in. Excuse me, so they will be turned on this afternoon. Your exam grades, we are meeting on Friday afternoon as a team. So I know it's Monday, but that'll be when all of the exams have been completed and we will meet together at a team to review the exam. So I know it's a ways to wait, but your grades will be in Friday evening. Um, does anybody have any questions up to this point? Is there any, how is everybody's working on your team project? Everything good there? All right,
I would
perfect.
like to get with I know two of the young ladies that's with London and myself. Um we have not been able to meet to get our stuff together or whatnot. And I was wanting to know if it's possible tonight. Can I think her name is Sarah and
Yep, I'm here.
hi Sarah.
Hi.
Um I started some of it, but I didn't want to I just wanted the input. I know we all have like busy lives or whatnot, but we're like on week 6.
Yeah.
And if we
Well,
can like put
you just want to, can
our
you message me on Canvas and we can get together? Because I'm
okay,
on campus all day and then I live an hour away. So
okay, okay.
just send
Because
me a
we have a
message.
class. We have a
What's
class
that?
after this. We have a
Yeah, I
class
have,
after this class
so do
that we're
I. I have two
that,
more.
that's the thing. We're in class all week long.
I know. I don't have class on Wednesday. What do you have Wednesday?
Um, we have our leadership class.
Okay. Well, just send me a message and then we can figure out like,
Okay, I'll send you a message and let me see who is our other person. Kristen. Kristen. Is Kristen on here?
Yeah, I'm here.
Okay. Are you okay with meeting up later?
I work tonight, but I can email you.
Okay. All right. Let me make myself a sticky note.
Good. Awesome. Anybody else? Mm. Chelsea, I can't see you. And Destiny, if you could turn your camera on, that would be great.
Oh, I had a question about that.
Um,
When we after we put our project together, do we have to represent that or anything like that, or we just do we have to submit it? Each of us has to submit it separately.
yeah, everybody submits it into Canvas separately.
Okay,
So
is that it? Just submit it separately. Each person submitted in Canvas.
correct. So once you have your team project done, then you'll all submit it into Canvas.
Okay, each one of us, every one of us submits it.
Mm-hmm.
Okay.
Yep. All right, Shemaya, Destiny, please turn your cameras on.
Ms. Martinez, I need
Yeah.
to step away just a moment. I need to put the space heater because I'm upstairs and it's freezing.
Okay. All right. So again, oh, and the other thing too, sorry, I'm getting some feedback. I don't know where the feedback is coming from. But I will also be sending your mid modules out. Okay, so you'll be getting those this week as well. Please review and return. And if you have any questions about them, of course, feel free to reach out to me. So we'll be doing all that this week. So just a heads up. So again, homework grades will be turned on this afternoon, and then your mid mods will go out, and you'll get your exam grades on Friday afternoon after we meet as a team. Um, so for today, we have some case studies to work through. So I'm going to share my screen. All right. So here we go. Case studies. I love case studies. All right. So we have Mr. Ramirez is a 52-year-old male. He's married with two teenage children. He is a part-time construction worker without any healthcare benefits. He speaks limited English with his primary language is Spanish. He presents to the emergency department complaining of chest pain that started 2 hours ago while at work. He describes the pain as a tightness radiating to his left arm and jaw. He took 2 tablets of acetaminophen at home before coming to the hospital. He delayed seeking care because he was worried about hospital costs and did not have health insurance. His wife eventually persuaded him to go to the ED when the pain worsened. All right, so here is your assessment. We have a blood pressure of 158 over 92, a heart rate of 102 beats per minute. It is irregular. We have respiratory rate of 22 breaths per minute. We have a temperature of 98.6, and we have a SpO2 of 93% on room air. He is pale and diaphoretic. He has mild shortness of breath, and he complains of chest pain 7 out of 10. He had on his EKG, he had a ST elevation in leads 2, 3, and AVF. We have troponin elevated. We have a clear chest x-ray, and we have a CBC and a CMP that is within normal limits. So what do you think is going on with the patient? So again, he had complaining of chest pain started 2 hours ago while at work. He described the pain as tightness radiating to his left arm and jaw. He took tablets of acetaminophen at home before coming to the hospital. And these are his vital signs and his physical findings in his labs. So what do we think is going on with him?
Uh,
Do you have a
I would say
MI?
maybe an MI at first because he had the pain in the left arm.
All right, good job. So yeah, so we think that he's having an acute MI, and he's having a STEMI. What's a STEMI? Anybody heard of a STEMI before? So he had on his EKG, he had ST elevation, okay, elevated troponin. Okay, so a STEMI or a ST segment elevation MI, it's a severe type of a heart attack. They have a complete blockage of one of the coronary arteries, sorry, leading to significant damage or death of the heart muscle. Okay, so an ST elevated MI is a severe type of heart attack. All right, so they have a complete blockage of the coronary artery.
I'm sorry, one of the students is not muted and it keeps echoing every time.
Yeah, I was about to say the same thing.
And I don't know who's muted, who's not muted, because I'm looking at everybody and everybody is muted. So it's like really weird that there's like all that. I don't know. I don't know where the feedback is coming from. All right, so we've determined that he is having an acute MI. All right, so plan of care. We're gonna do immediate administration of oxygen, right? Because his O2 sats were low. They were at 93%. We're gonna do sublingual nitroglycerin. So what's sublingual nitroglycerin going to do for him?
Alleviate his
Bring
pain.
down the heart rate, or bring down the I think it'll bring down the heart rate or blood pressure because it's immediate. Um,
Okay. Yep, it's used to treat, right, the chest pain, and it's going to dilate the blood vessels, right? So absolutely, it's going to bring down the heart rate and the blood pressure, right? Because when we dilate, right, we cause a drop. Constriction is going to increase pressure. Dilation is going to decrease pressure. What are some of the potential side effects of that nitroglycerin?
Headache.
Headache, absolutely. What else could they have? Think about what happens when we dilate and we drop our blood pressure. What other effects could we have?
Hypotension.
Okay, we could become hypotensive. Yep.
Dizziness.
dizzy,
Dizziness, lightheadedness.
dizziness.
Perfect. Good job. Yep. What should they feel when we put that sublingual nitroglycerin underneath their tongue?
I think a sudden relief on their chest pain, or
Okay,
almost sudden relief on their chest pain.
okay. How do we know? So think back to pharmacology. How do we know that the nitroglycerin is still effective? What happens? What should happen when they put it under their tongue? Anybody remember? It should burn a little bit, right? They should get a little bit of a burning under sensation underneath that tongue. We're going to do aspirin, 325 milligrams, chewable aspirin. Why do we give aspirin?
This is a blood thinner.
Okay. Um, okay, sorry. Yes, it's a blood thinner. What else? So it'll prevent the platelets and blood clotting growth that can hurt, and then
Yeah,
it's also
emergency break
cardioprotective.
it down.
All right. Morphine we'll give for pain, right? What do we have to watch for with morphine?
It can't be pushed fast. It has to be pushed slowly.
Yeah, but
Okay.
it has to be like a slow I think a slow IV push rather than a rush because you want to slowly take. You don't want to do it too fast.
You have to watch
Okay.
their respirations.
Watch the respirations, right? Because it's a central nervous system depressant and it could suppress their respiratory drive. Absolutely. And then we'll put them on the continuous cardiac monitor, right? Because we want to make sure. And we're going to prepare him for transfer to cardiac catheterization lab for a percutaneous coronary intervention. All right. So we taught with that. My gosh, I'm sorry. Like my ears are clogged, so I'm like can't hear myself talk. Can you guys hear me okay?
Mm-hmm.
I don't want to feel like I'm yelling. Okay, so with the STEMI, right, we're going to have that. We have a blockage of a coronary artery. So we're going to bring them into the cath lab so that we can open up that artery. We're also going to consult case management and social work because he is uninsured, right? And that was one of the reasons why he didn't want to go to the hospital was because he didn't have health insurance. Um, and he knows that the costs are going to be pretty high. All right. So Mr. Ramirez expresses anxiety about hospital bills and states, I can't afford this. I don't have insurance. Please don't do anything expensive. His wife is tearful and states that he avoided going to the doctor for years due to the cost. So we'll look at patient advocacy, ensuring Mr. Ramirez receives emergency treatment under EMTALA. EMTALA is the Emergency Medical Treatment and Labor Act. Have you guys heard of that before? Has anybody heard of EMTALA before? I saw a couple heads shaking. So the Emergency Medical Treatment and Labor Act. Basically, it's a law that requires any hospital that participates in Medicare, is it yeah, Medicare, They provide, medical treatment basically to everybody, regardless of their ability to pay. All right. So they have to stabilize those patients regardless of their insurance status. Um, so he is required to get care. Cultural competence, use of interpreter services to communicate effectively with Mr. Ramirez and his wife. So why do we not use family members as interpreters?
Because they can trickle down, water down what they're translating. They might translate something completely different than what the nurses want.
Okay, so they may not translate it appropriately. Okay, what else?
They can have a biased opinion.
They have a biased opinion. Okay. They also may not tell you everything, right? So they may not give you
Be
all of the,
truthful.
right? They may not be truthful. And then even using family members, right? I'm so sorry. So when we're, giving information to the family, they may not understand the information that we're giving them as well, to try to, um, you know, uh, translate it to the client themselves. Um, Health promotion would be to educate Mr. Ramirez on lifestyle changes and the importance of follow-up care and emphasizing affordable community resources. So after an acute MI, what are some lifestyle changes that Mr. Ramirez would need to make just based on what we know? Okay. What are some lifestyle changes that he would need to make?
Diet and exercise.
That's what I was about to say, that diet and exercise. And I didn't see in it, but if he does smoke at all, he'll probably go and quit smoking. If he does,
Yeah.
I didn't see it in there.
It doesn't say, just so you know, we don't know. Because we didn't, that wasn't one of the things in here. We didn't ask about his smoking history, but you're absolutely correct. If he smokes, we'd want him to quit smoking. We want diet, exercise. So what kind of diet? One second. I need to sneeze. What kind of
Bless you.
I'm
Bless
so
you.
sorry. Excuse
Phew.
me. Oh, fighting a cold, and I'm just like, um, so what kind of diet? What would consist of a heart healthy diet?
Staying away from
Carbs and lots of
fatty
fat.
foods, fried foods, processed foods, having foods that's low in sodium content, like try to tell him like with him and his wife, well he's only 52, he's kind of young, but like not having like canned foods, lunch meats and stuff like that, stuff that's like high in sodium. Um, you want to have him on like a cardiac diet.
Okay, what is a cardiac diet? What should we
Um,
eat more of?
Fruits and vegetables,
Okay,
green
so
leafy,
fruits, vegetables, your whole grains, right? Nuts, fish.
protein.
So you were right. You want to limit some of those processed foods, red meat, right? The sugary type drinks, the fried foods. Alcohol would also be included in this too. We want to exclude, we don't want them to have excessive amounts of of alcohol. They could do the DASH diet, right? Or the Mediterranean diet, just depends on his needs. But just from personal experience, right? Hispanics, um, a very high in carbohydrate diet, right? Lots of rice, like lots of tortillas, that kind of thing. So we have to look at that as well. And how would we incorporate that into his diet? What are some things that we could do culturally that we could include in his diet, right? How would we
Limiting the amount of tortillas he eats or switching over to low carb tortillas.
There you go, right? There are low carb options, right, that we can look at as well. All right, exercise. So he just had an acute MI. What are we going to talk to him about? How are we going to talk to him about exercise?
Maybe we can suggest just take a simple walk around the neighborhood, or maybe go spend a day at the park and just walk. Something simple like that, and maybe work your way up over time. Or if it's still too much, just stick with the walk at least to help lower your blood pressure.
There you go,
At
right?
least try
Perfect.
to
Short
do
walks, right?
like
Gradually increasing the duration as well as the intensity, right? Because obviously he just had a acute MI. We don't want him like going and running around the block, right? We want to gradually increase that. Um, they could also do some strength training that will be helpful as well. And then, of course, if he does start walking and he experiences any chest pain, obviously we want him to stop, right? Um, another big thing too would be stress management, right? So, um, stress management is always important. And he is, what they say, he is a construction worker, part-time. So we don't know, if that's his main source of income, right? I don't know if anybody knows any construction workers, but that could be a very stressful job, right? It requires a lot of heavy lifting, and things like that. So, that could be an issue as well. And then another big part would be educating about medications, right? So he doesn't have insurance, but he is going to need to be on medications after this MI, right? So we have a lot of education and things that we need to talk to the Ramirez family about. Um, so we kind of told, we talked about we're going to do O2, we're going to do the nitro, the aspirin, we'll do morphine and continuous cardiac. But what immediate, those immediate interventions, right? Getting them started. So what were the indicators of the MI that we needed to recognize quickly? I know we talked about a lot of it already, but what were some of those symptoms that we need to pay attention to?
The chest pain, check vital signs if you're not feeling well, if possible. I think it's that left arm pain.
yeah. That's what I was gonna say, the
Right?
left
And
arm
and he
pain.
had the jaw
Maybe
pain,
a
right?
headache. Maybe a headache or
Uh,
feeling a little sweaty.
yep. Very diaphoretic, shortness of breath, right? They also could have some nausea and vomiting with an acute MI as well. Um, they may be pale, right? So that could be an additional symptom that they're experiencing. What about Intella? So I told you what Intella is. And so how does that protect people? How do you think Intella protects people?
It doesn't allow hospitals to turn them away, to still treat them like they're not being biased. Oh, you don't have insurance, so we're not going to treat you. So they're ethically treating everyone as a person.
Right. They have to provide that non-discriminatory screening, right? If
Yep.
they have an emergency condition, they have to be treated. All right. Regardless of their ability to pay. Um, what do you think? What could you do if the patient refuses care due to financial concerns?
At first, maybe you can talk about them, but normally, if they decline treatment, usually you would respect it and just document it and let the doctor know, or I think that would be about it. Just document it. Or maybe ask them like open ended questions, saying we got options, recommendations, some options if they still say no.
Yeah, I mean, there's going to be, I think in this case, especially too, telling him that this is really a life or death situation, right? They need to get care. or they, again, it could be potentially life-threatening. We can, explain the risks, regarding the, refusal of care. We could also try to get, a social worker involved, right? Maybe the social worker can help. Because again, with Entella, the hospital has that legal, what is the word, they have to stabilize that patient regardless. Again, even if they confused, even if they refused. How should the nurse ensure effective communication given the language barrier? So we talked about this, right? um this would be making sure that we are providing them with a translator, right, that speaks their language, so that we're making sure that he gets the information that he needs. Um, and what are some other strategies that can help to improve trust and reduce fear related to cost? Now, this is the big one.
You could do something simple by just staying with the patient and just advocating for them.
Okay, advocate for the patient. Absolutely. Even as much of, telling them we're not going to do any excessive tests, right? We're just going to do what the necessary tests are in order to stabilize him and prevent any further damage to his heart and the rest of, his organ systems. Um, and, again, being just that open, honest, therapeutic communication, right, that we're going to use. So when we look at it, how does lack of insurance, how does it impact health outcomes?
When people don't have health insurance, they if they have to pay a bill versus get their medication, they're gonna pay that bill before they get their medication. So
Mm-hmm.
that's when like the health disparities or whatnot, like we as nurses, we gotta advocate for our patient. That's when we want to call in the interdisciplinary teams to come help um because they don't have health insurance, and you don't want to be the one like know that they leave out and they die.
Mm-hmm.
But
So,
it plays a big part because when you're looking in different um areas like the social, what is it called, the social determinants of health 2030 or whatnot, how
mm-hmm,
they say that in certain communities they don't value the health insurance, right?
mm-hmm,
Versus where someone who is they have a career, they have a family, they're going to get health insurance, right?
mm-hmm.
I think I'm going a little too far.
I was gonna
Um, so if I don't have health insurance, it starts way back at the beginning, right? If I don't have health insurance, that reduces my access to healthcare. All right. Plain and simple, right? Because it costs a lot, even just to go to the doctor, right? So uninsured adults, especially, are less likely to have the regular physical exams. They're not going to go to the doctor and get their blood work. They're not going to get their screenings, their immunizations, right? And that is a huge issue. They don't have proper, even chronic disease management, for diseases like diabetes and hypertension, right? Cardiovascular disease, which then is going to increase their mortality rates. Um, if they aren't going to the doctor and they're not getting those checkups, then diseases are often detected at later, more advanced and harder to treat stages, right? They also, believe it or not, have a higher risk of dying in the hospital and receiving fewer services, which is really, kind of, it's kind of scary, but think of all this. So let's go culturally with Mr. Ramirez being Hispanic, okay? And I know he's Hispanic because his language is Spanish, okay? So I'm not just assuming. But what are some of the health risks in chronic diseases that are higher in that population?
Diabetes,
Okay, diabetes, what else?
hypertension.
Hypertension, right? Some two of the big ones, right? And so diabetes, hypertension can lead to stroke, heart attacks, right? So if we're not getting that chronic disease management in that early screening, we're going to have some more detrimental outcomes. So what community resources can nurses connect uninsured patients with in real world practice? So what are some community resources that we can connect them to?
Like the Medicaid, Medicare, or GoodRx, things like that.
Okay. So yeah, GoodRx. Um, that's yeah. Even what about there's, most areas have free clinics, right? Or free or low cost clinics that may charge based off of income, right? So that would be another one as well. The government programs as well, so Medicare, Medicaid. Um,
And a lot of hospitals now will have like finance programs where they have like in hospital
I
health
think
insurance. If you keep coming, like Ohio Health has one where through their finance program, they will let you pay like based on income or something like that. So even if you
yeah,
don't need it for the government, you could meet it for a private hospital or a community-based hospital.
yeah, some have the sliding
absolutely.
scale.
Yeah. And some of your community-based hospitals are also nonprofit organizations, right? So they may even provide some free services. Um, there's in down here in Texas, you can call 211. It's actually a phone number. I don't know if there's other ones like in other areas too. And that will help to find resources for food, for healthcare, even housing if they need housing. So there's that. Getting them in touch with social services, right? Social worker, other social services may also help. Um, there also may be some local charities, right, that may be able to assist as well. All right, good job. So next one, we have Miss Sharon Lewis. She is a 68-year-old female presenting to the emergency department with difficulty breathing. She has an allergy to penicillin. She has a past medical history of type 2 diabetes, hypertension, and COPD. She is admitted to the med surg unit from the emergency department with shortness of breath, productive cough with yellow sputum, and fatigue for the last 5 days. She reports increasing difficulty breathing despite using her home albuterol inhaler. She lives alone and she has not been eating well. So just reading this, what do we think could potentially be going on with Miss Lewis?
Pneumonia.
Sounds like pneumonia, right? All right. So her temperature is 101.8 degrees Fahrenheit. She's a heart rate of 112, a respiratory rate of 26, blood pressure of 148 over 88, and her O2 sats are 88% on room air. She has crackles in her right lower lung field. She has shortness of breath with minimal exertion. She has a productive cough with thick sputum. She appears fatigued and anxious. So her white blood cells is 14,005. She has a blood glucose of 196. She has right lower lobe consolidation on X-ray, and the sputum results are pending. So what would be some immediate interventions for Miss Lewis right here?
Oxygen.
Oxygen, right? Because her O2 sats are
Our
what,
O2 is
88%?
88% on room air, so we want to be mindful that she has COPD, so we don't want to give her too much oxygen. We're gonna start off on 2 liters nasal cannula.
Okay, so what else will assist her with her respirations?
We want to set her up in a high Fowler's position. Freckles in her right lower lung field.
Whenever she needs to, just encourage her to cough.
Okay, encourage her to cough and deep breathe. Okay.
We can offer her some water.
Oh yeah, we could offer her some water if we needed to. What does that white blood cell count tell us?
Infection.
What kind of infection?
I don't know. Oh, I'm sorry.
So if it elevated white blood cells usually tell us what? That there is usually some sort of bacterial infection going on, correct? All right, so let's see. So we're going to do the oxygen at 2 liters per minute via nasal cannula. We're going to do some IV fluids at 75 mLs per hour. Levofloxacin is an antibiotic, right? We're going to give 750 milligrams per day. We can do the acetaminophen for fever. We can do the incentive spirometer. How to use an incentive spirometer?
Don't you deep blow into it until the ball goes up into the.
So incentive spirometer.
Wouldn't that you inhale and try to suck it?
Say that again.
He said, "Don't you inhale and try to suck it, but don't you you
Yes. Hold
blow
on.
or you inhale it."
Oh, I have one and I can't find it. So yes. So I don't know where it is, but I do have one. I was going to show it to you. I just don't know where I put it. But you do. You have, there's a, oh Lord, where is it? It has a tube attached to it. Um, Here it is. This is just a nice little generic one. Right, so it has a tube attached to it, and then you breathe in. I can't breathe in right now because I can't breathe. To breathe in, okay, but you would suck in. Okay, and the goal is to get it as high as you can. Um, and how often should we do it? I mean, it says Q2 hours while awake, right? So what I used to tell my patients is when you're watching TV, right? Um, if when a commercial comes on, right, go ahead and do it a couple times, get get it, your lungs, expanding. Um, Sorry, get back in the box. Um, we'll do the blood glucose monitoring before meals and at bedtime. And we'll put her on a diabetic diet and activity as tolerated. So if I'm feeling shortness, short of breath, what should my meals look like?
Small.
I wanna have
Right.
small, light meals, like more light instead of something heavy.
Right. Doing like the six small meals a day, right, would be more beneficial than three large meals, right, during the day. Because what happens if you are full? How do you feel when your like belly is full?
Bloated.
blo- Bloated, right? It may even make it more difficult to breathe, right? Think about like Thanksgiving dinner or Christmas or a holiday meal, right? You eat a lot of food, right? What happens, right? You're full, you may have a little bit, you feel like you're short of breath. So those six small meals a day, right, may be better. Um, what kind of foods do we give them on a diabetic diet?
No sugar.
Okay. Right. We want to limit limit our sugar impact. And where do we get sugar from in our diet?
Fruits.
Is it just sugar that we have to worry about?
I think is you have to lower your carbs.
There you go. Yeah. We have to lower sugar. We also have to lower carbohydrates, right? And we want to, especially those refined carbohydrates, like I'm trying to think of those are like your white rice, your white pasta, your white bread. So encouraging like whole wheat bread, even the brown rice, right? Those help to increase fiber as well as to decrease the amount of carbohydrates that are in them. um, Fruits, more of your lean proteins like chicken, turkey, fish, eggs. Um, you want to avoid like the same thing like we would with a heart healthy diet. You want to avoid the fried foods, the processed foods. Um, and then the high sugary drinks, right? So avoiding the, what do you call it? Like the regular sodas, right? Using more like diet sodas. Even some fruit juices are particularly high and sugar as well. Portion control, right? We gotta making sure that we have good portion control for our diabetics as well. And activity is tolerated. So she's short of breath, right? We talked about that. She's short of breath. She has a cough with yellow sputum. She's got fatigue. All right. So her activity level, right, initially is going to be pretty low as the antibiotic starts to work, right? We're doing the coughing and we're doing the deep breathing. Gradually we can increase her activity, right? But we don't want her to get overly exerted, right? Because that's just going to increase her shortness of breath. On Miss Lewis, whew, Miss Lewis continues to have low oxygen saturation despite being on 2 liters of oxygen and shows increased fatigue. Her oral intake remains poor and she is coughing frequently. The night nurse notes that she was too tired to use her incentive spirometer overnight. The nursing student assigned to Miss Lewis must determine how to adjust the plan of care using critical thinking and evidence-based practice. All right, so we still have some low oxygen saturations, and she is showing increased fatigue. She's still not eating well. She's coughing more. The night nurse notes she was too tired to use her incentive spirometer overnight. So what can we do for Miss Lewis?
Is she still in the nasal can?
Yes.
Maybe we could do a full mask.
Okay, so maybe we could do a mask. Okay. What else could we do for Miss Lewis?
Her oral intake is poor, so we probably want to get what is that? That clear um like the protein shakes or whatnot.
Okay, so some oral supplements like Ensure, Boost,
Yeah, but not like the
Glutathione.
thick ones, like the clear ones they have.
Oh, the ones that are juice-based rather than the milk-based products.
Yeah,
I
because she
can't
has
remember
that
what they're
sputum.
called.
don't want her to. I don't know what it's called, but I know I see it a lot, like electrolytes and stuff like that.
So she, at this point, she needs more than just electrolytes. She needs to get some protein and stuff. Remember, she's sick, right? And so let's go back. She had a temperature of 108, 101.8. She had a heart rate of 112. Her respirations were 26. So everything is elevated. All right. And when we're sick, what happens to our metabolic rate?
Goes down.
Our metabolic rate goes up, okay, because our body is fighting infections.
Oh,
So
fighting
what
the
does that
infection.
mean? We need more nutrients to make sure that our cells have fuel in order to keep fighting off this infection. So, um, so yeah, so this is going to require some Ensure Clear is one of the ones. I had to Google it because I couldn't remember it. Ensure Clear has um and then there's a Boost Breeze, which is another one that is more juice based than it is milk based, right? So it's not as thick. Has anybody ever tried like Ensure or Glucerna? Yeah. Ensure is not that bad. It really is not. It depends on what flavor you get. Um, it's not that bad. The Ensure pudding is not bad either. I haven't tried the fruit-based ones. My mom drank a lot of Ensure. Her favorite was the butter pecan flavor. So, um, Glucerna has a different taste only because it's the one that we use more for diabetics. So it's not as sweet as Ensure is. It has, just that different taste. So what else can we do? We have to get some nutrition into her. Um, we have to, because of her metabolic rate, she needs the nutrition. She's still getting, she's still really fatigued. What else can we do?
Give her an IV.
Okay, I think, does she have
No.
IV fluids? Yeah, she has got IV
Oh,
fluids. Yep. So let's see. What are some additional assessments we can do to evaluate her respiratory status?
Well, we want to see how far um her mobility is, like, sitting up, probably walking to and from the bathroom to see how tired she gets.
Okay.
Because when you have pneumonia or you've been sick, you're wore out, right? But if we get you up and get you moving, we can get that fluid to start moving out of your lungs instead of just laying down. So we want to get her up, maybe sit her up in the recliner or something.
But what if she's extremely fatigued? That also puts her at an increased risk for falls if we were to get her up and try to get her to move around. So, what else can we do? So, we can listen to her lung sounds. We can evaluate her SpO2. Um, what
Could
else
she
can we
do
do?
like some breathing techniques
Mhm.
to help her I guess just to kind of take her time breathing like with some techniques maybe?
Okay. So she also has what? She has a past history of hypertension and COPD as well. So what are some breathing techniques that we would teach a client with COPD?
pursed lip breathing.
Pursed lipped breathing, right? Have you guys heard that before? that pursed breathing and um I'm try- um um
What's the one called where they put the bedside table and they kind of like breathe over the bedside table?
so you're talking about the orthopnea. So it
Yeah,
doesn't
like
say
the
that she
pillow.
has orthopnea, but you could make sure that she is sitting up straight, even potentially using that tripod position to help her to increase her lung expansion. But with the pursed lip breathing, all right, you want to make sure you want to have them breathe in through their nose, and then you want to pucker like you're going to whistle. Um, and then exhale or breathe out slowly through the pursed lips. But you want to make sure like their cheeks aren't puffed out. So it's just like they're whistling. So I can't breathe in through my nose, otherwise I would show you. I can breathe in through my mouth. And then without doing that, you want to like breathe through their nose. And this is good for when people have shortness of breath or whether it's somebody that has COPD or even for yourself, if you're out exercising and you feel short of breath, you can try the pursed lip breathing, even for anxiety and things like that. So like before an exam, but the goal is to help to slow their breathing. It also helps to reduce their work of breathing. Again, it helps to reduce the or relieve the shortness of breath. It also helps to calm the nervous system too, right? Because think about it, it's a vicious cycle, right? You're short of breath because you have pneumonia and you have COPD. And when you feel short of breath, what happens to your anxiety? Your anxiety goes up. And then what happens when our anxiety goes up? Our respiratory rate goes up, right? So it's a vicious cycle. So if we can get the respiratory rate down, we can also help to decrease her anxiety, right? Which will help calm the nervous system. um, with the persistent low oxygen, right? So she did it say, yeah, it still says that her O2 sats are 89 to 90%, right? She has COPD, right? So those low oxygen saturations may be something that is normal for her, right? Because she has the COPD. And why do we not want to bump up the oxygen?
Because if we do too much, you might force.
Right. So people that have COPD are used to the higher levels of CO2 in their body, right? And so if we give them too much oxygen, we may actually suppress their respiratory drive. And so based on pneumonia management guidelines, what interventions could help improve the oxygenation and promote secretion clearance? So we talked about the pursed breathing, talked about sitting her up, maybe leaning over the bedside table, sitting in the tripod position. That'll help for lung expansion as well as sitting her up in a semi-high or semi to high Fowler's position. What are some other things that would help to promote secretion clearance?
Um, if since she has a history of COPD, maybe a diuretic to help fluid.
Okay, so maybe a diuretic, in addition to the fluid. Um, We could also do, and granted, she's getting the 75 mLs per hour, right? But maybe even increasing the fluids, right, to help thin out the secretions so that it's easier for them to um, to cough. The postural drainage as well. If she's not, she doesn't have a whole lot of energy and she's laying in bed, maybe you can try some postural drainage or some chest physiotherapy, to help mobilize secretions. And then, what about a mucolytic? Like, what is it? Mucinex, right, to help break up, or trying to think of what else. Um, the incentives barometer, we know that this thing does work when they can use it. There's also the huff, the control coughing. I don't know if anybody has heard of huff, can't even say it, huff coughing. This helps, and also helps to clear the airway as well. And so I probably couldn't do this, but you inhale, you want to get as much inhale as much as possible. You want to hold your breath, and then you want to like make a huff sound as you're like blowing the air out. Uh, those are called huff breaths. And sometimes that will help to move the mucus as well. Um, but yeah, you're turning, you're coughing, you're deep breathing, all of those things help. The incentive spirometer will help. If she has COPD, maybe we could get respiratory therapy to come in as well. Maybe some, respiratory treatments may be effective for her. But we know that when we look at using the ABC framework, right, we know that the nurse's priority action is definitely going to be that airway. Um, and so I like this question. So, how should nursing care be adjusted to manage Miss Lewis's fatigue while ensuring treatment effectiveness? All right. So, you know, we know what she needs to do because we're your nurses, and we know that the treatments that she needs to perform and to have are extremely important. They are going to um, make her feel better eventually. And it can be, it's frustrating sometimes as nurses, right, that they're not always able to follow the plan of care that we are providing. So, how can we adjust things so that she's, still getting the treatments that she needs?
um, by breaking things up when it's like something that's more physically exerting, like splitting
Okay,
it up and giving her rest breaks in between.
there you go. Yeah, kind of splitting. Yeah, alternating. Um, alternating periods of rest with activity, right? Just kind of gauging how she is. Um, what else? Just a lot of encouragement, right?
I
You
was
still want,
thinking an in-home nurse just to help her keep on track.
okay, so when she's discharged, maybe getting her some home health care to follow up with her. Okay. Um, and then which members of the healthcare team should be consulted to optimize Miss Lewis's care?
Physical therapy.
I'm sorry.
Physical therapy.
Okay, physical therapy. What else?
Respiratory therapy,
Respiratory therapy. Okay.
dietitian to help with the
Dietitian.
smaller meals.
Okay.
And you also could do like OT just because she got weak. You know, like she could have lost like a little of her mobility to hold her spoon or, just to make sure that she don't need more interventions.
So physical therapy will help with the muscle strengthening,
Mm-hmm.
right? So she's weak. When she starts to feel better, um, then we could get her muscle strength up. OT would help with like her ADLs, right? So she has COPD, and so how to manage her shortness of breath while still performing her ADLs. Respiratory, absolutely, right? Whether it's doing um, um, the breathing exercises, the respiratory treatments. What else? Trying to think of what else. I think one of the coolest things I saw, this was a while ago. Um, my mom was in the ICU. Um, and the bed that she has, the bed that she had in the ICU, um, when respiratory would come in and do her treatments, I never seen this before. I don't know when they had come out, but between the last time I was in the ICU, and then my mom being in the ICU is when I saw these. That she flipped the respiratory therapist flipped a switch on the bed and the bed vibrated. Has anybody ever seen them? No. So one of the treatments that we use, for people that have like the severe pneumonia, cystic fibrosis, and things like that, is like an oscillating vest. All right. And it shakes them up. Okay. And it helps to break up the secretions. So when the respiratory therapist came in and put the nebulizer on and caused the bed to vibrate, so the vibration with the respiratory treatment, it helped to break up the secretion. So then once the treatment was done, she would have, it would be easier for her to cough up. She did not have pneumonia. My mom had sarcoidosis. But so, and, from laying in bed, it helped to break up the secretions, so that they didn't settle and then lead to pneumonia. So that was one of the coolest things they had. Like I said, I don't know this, my mom passed in, um, shoot, 2016 is when my mom passed. So that was, I mean, obviously it was still a while ago, but I thought that was really cool. Because, I think that was the last slide. Yeah. So, there are things like that as well. Fluids is always going to be super important, right? Fluids are necessary, and maybe, we have to still be careful with even increasing her IV, right? Because increasing her IV could lead to fluid overload. Um, uh, and Matthew mentioned diuretics, and I didn't want to discount that. Um, we have to be careful with diuretics. Um, Only reason being is because diuretics aren't going to be able to pull the fluid, like pull the mucus, right? They can pull additional fluid. But in her case, if she doesn't have any cardiac issues, like, although did say she had hypertension, so we do have to be careful with the fluids, but pulling the extra fluids out is only going to lead to more dryness, right? So then we could have, potentially have the issue with, not getting enough secretions in there to help break up the secretions. Um, so just the thought there. But if she, were to remain hypertensive, then we probably would either limit or slow down the IV infusion. Maybe not necessarily um, giving her diuretic, but it would have to just kind of play. You see how it played out with that goes. But you guys did good. I mean, the small meals, the positioning, increasing. What else could we, here's a good one. Fatigued. So what are some things that we could do at night to maybe help her sleep a little bit better?
Dimmer lights, cut down a lot of stimulation like the TV, the noise.
Okay.
Yeah,
Uh,
I always say a cup of warm milk.
oh, no, not with someone with COPD. Ooh,
A
that would just
disaster.
thicken
Coffee.
everything up. Yeah. Um, so, increased work of breathing. So a nice cool environment, right? Making sure that it's not hot. You want to provide a nice cool environment. Again, sitting her up. If she's got a lot of coughing going on, we can do some cough suppressants at night. Cough suppressants at night will allow them to sleep, or hopefully allow them to sleep a little bit better, right? So they can get a little bit more well rested, or not well rested, a better rest, right? If they're not up coughing all night. Um, again, sitting them up. Um, I'm trying to think of what else. Um, good oral care. Good oral care is always going to be something that we can use as well. I'm trying to think. Um, I don't know. This is, you know, I spend a lot of time I spend my nights in long-term care. I don't understand how these people sleep all night with their televisions on 100. I don't know how they do it. But I'll go in and I'll see them, and they're in there sleeping, and the TV is on 100, and I have to turn it down because I can hear it all the way up at the nurse's station. So
I'm the night
I know
creeper.
that people on the hallway can hear it as well. I don't get it.
I'm turning everybody TV off at night. As soon as they sleep, I'm like, yeah, ding,
Well,
ding.
I do have to be careful because some of them, if I do turn off their TV, then they'll wake up like super quick. So I have to be really careful with that. Um, but yeah, it's just interesting. I just don't, I don't know what made me think of that. I guess, how do we promote sleep? And I think like, um, yeah, like they have their they have their television on 100, and okay. They're just sleeping. All right, so I'm gonna pull up a couple questions. I've got some on trying to see why this won't let me. Um, let's see. I'm trying to all right, let's do well. There we go. I think we have time for 5 questions. So I pulled up oxygenation. I forget. I picked a couple of different categories. So let's do some practice questions. All right. And you can use the chat or you can speak out. Either way is fine. All right. So the home health nurse discovers that an older adult patient has been sharing his pain medication with his daughter. He acknowledges the dangers of sharing, but states, "My daughter can't afford to see a doctor or buy medicine, so I must give her a few of my pain pills." Which member of the healthcare team would the nurse consult first? The healthcare provider to renew the prescription so the patient has enough medicine, the pharmacist to monitor the frequency of the prescription refills, a social worker to help the family locate resources for healthcare, or a home health aide to watch for inappropriate medication usage by family. All right, so you only got one answer. So yes, it is the social worker. So the social worker can maybe help to find affordable alternatives. Then the father is more likely to stop giving his medication to his daughter, right? So this happens more often than it ought to. And so um how do we fix that, right? That, can't keep sharing the medications. Next, see. All right, people at risk are the target populations for cancer screening programs. According to the latest screening recommendations from the American Cancer Society, which of these asymptomatic patients need extra encouragement to participate in cancer screening? All right, so we have a 25-year-old African American woman who is sexually inactive for a pap test. Or we have a 30-year-old Asian American woman for annual mammogram. A 45-year-old African American man to talk with a healthcare provider about prostate cancer. A 55-year-old white American man who smokes to talk with the healthcare provider about lung cancer screening. A 50-year-old white American woman for colon cancer screening, and a 70-year-old Asian American woman who had a total hysterectomy 15 years ago, not for cancer reasons, for a pap test. This is a good one. All right, so again, people at risk are the target populations for cancer screening. So which of these asymptomatic patients need extra encouragement to participate in cancer screening? All right, we got it. 3, 4.
I say 3 and 4.
All right, so we did have some say 5 as well. Anybody else have any? All right. So the correct answers are 1, 3, 4, and 5. So at 25 years old, women should have a pap smear regardless of sexual activity. So at 25, even though she is sexually inactive, she should still have a pap test. And then correct, the 45-year-old African American man, talk about the prostate cancer, the 55-year-old white American man who smokes about lung cancer screening, and then the 50-year-old white American woman for colon cancer screening. So good job. We just missed that one. I missed it too, because I don't know why. All right. So a primary nursing responsibility is the prevention of lung cancer by assisting patients in the cessation of smoking or other tobacco use. Which task would be appropriate to assign to an LPN? Oh, here's a good one. So develop a quick plan, explain how to apply a nicotine patch, discuss strategies to avoid relapse, or suggest ways to deal with urges for tobaccos. All right, so which task would be appropriate for an LPN?
Is this a select all?
No.
2 or 4.
2 or 4? Let's try 2. All right, so very good. Yes, explain how to use a nicotine patch, right? So how do the nicotine patches work? When should they put them on? When should they take them off? All right. Um, According to evidence-based guidelines from the American I can't even say the word, Optometric Association, which modifiable risk factor is the most important to emphasize during patient teaching to reduce the risk for age-related macular degeneration? Initiate smoking cessation, take vitamin D and E supplements, eat dark green leafy vegetables, or wear protective eyewear as needed. So which one of those is a modifiable most important to emphasize during patient teaching to reduce the risk for age-related macular degeneration?
I say initiate smoking cessation.
Good job. Yes. According to the American Optometric Association, smoking cessation is the most important modifiable risk factor for decreasing. Good job. All right, last one. According to evidence-based guidelines from another one from the American Optometric Association, which patient needs to have an annual or sooner as recommendation, as soon or sooner as recommended by eye exam. Jeez. 18-year-old who is asymptomatic and has low risk, a 40-year-old who is asymptomatic and low risk, 55 who is asymptomatic and low risk, and a 67-year-old who is asymptomatic and low risk. According to evidence-based guidelines from the American Optometric Association, which patient needs to have an annual eye exam? Okay. Yes. Who needs an annual eye exam? I know this one's kind of they're all low risk, but what age would require an annual or sooner eye exam?
Would it be the 18-year-old since they're still young and
We'll go
they
with
can go ahead and
18.
start off?
Who is it? It's the 67-year-olds. So people 65 and older are advised to have eye exams annually or even more frequently, even if they are low risk. 18 to 64 with low risk are advised to have eye exams at least every 2 years. I'm not gonna lie, Latoya, I struggled with that one too, because I was thinking an 18-year-old too, but then I was like, okay, no, maybe not, because he doesn't have any issues. So all right, good job, y'all. So class is over. I will see y'all next week. Again, don't forget I'm gonna turn homework grades on tonight and you'll have your exam grades on Friday. But y'all have an awesome week and I will see you next Monday.
So are we going to get our lessons for week 7 this week, our PowerPoints?
Yes.
Okay. So it'll be like
Or
later.
no, the lessons for week 7 is not till next week. We're only in week 6.
Oh, we're week 6. Oh,
Yep, don't do that. I'm
I'm
confused.
rushing. I'm
You are
rushing.
rushing.
I want